Houston's iconic Art Car Parade is this Saturday, and downtown Houston is the place to be for the Art Car After Party on Saturday from 5 to 9 p.m. This one-day free celebration at Market Square Park will feature a showcase of art cars, a chance to meet and talk with artists, live music, lawn games, and other fun activities for the whole family. There's nothing like gathering with community while celebrating creativity right in the heart of downtown. Learn more about the Art Car After Party at downtownhouston.org. Hey parents, are you looking for a diverse private school with top academic results in a state-of-the-art campus serving children from pre-K 3 to 12th grade? Then you need to check out the British International School of Houston. Their teachers are global talents who inspire confidence, resilience, and creativity within their students while helping them chart a path to the world's best universities. Search BIS Houston today to learn more about the British International School of Houston. And while you're on the website, you can also schedule a personal tour with their admissions team.
Today on CityCast Houston, a second child with the measles has died in West Texas, and Health and Human Services Secretary Robert F. Kennedy Jr. visited the epicenter of the outbreak over the weekend. It makes us wonder just how long will the measles outbreak last, and how can we protect ourselves? I dig into that with two public health advocates from Legacy Community Health. It's Monday, April 7th. I'm Laura Eisensee, filling in for Raheel Ramzanali, and here's what Houston's talking about. I want to welcome in Dr. Sandy Cohan, who is the medical director at Legacy's clinic in Southwest Houston. Thank you so much for joining us.
Thank you for having me.
And also Lorena Motu, who is a nurse practitioner with over 11 years of experience.
Thank you for having me. I'm excited to be here.
So the measles was officially eliminated in the U.S. back in 2000, but now it's back. I want to remind listeners exactly what this infection is. Dr. Cohan, can you break that down for us and also explain just how serious this infection is?
I think the focus on how serious the infection is the right thing to start with. Before we had that measles vaccine, each year in children, we saw more than 50,000 hospitalizations required for children who got the virus and more than 500 deaths. So when we're talking about a virus, it's different than the common colds that we are seeing every day in our clinics. At the same time, both the common cold and measles causes cough, congestion, conjunctivitis, which is when your eyes get red and teary, as well as a significant rash. The other thing that makes this different from the common cold is just how contagious it is. So the average person that has measles is able to infect 18 different people around them. Even though all of our patients, Ms. Motu and I are pediatricians by training, all of our patients are constantly snotty and contagious, and we see it every day. And we're very grateful that we're not putting any of our other patients at risk by having those children come into our office, which would happen should we have a patient with measles come into our office.
I think also another thing to keep in mind is as we're in different parts of the area of Texas that we're seeing some of these exposures and cases of measles, we also want to keep in mind of the local herd immunity and how vaccinated and protected our local patient population is. And I know that's one of the big factors that we're looking at as far as keeping an eye on how the spread is going to affect Texas.
Well, let's talk more about that, how this spread is affecting Texas, because when this outbreak started back in late January, there were just 2 cases in West Texas. And now we're here in April, and every week we're seeing dozens of new cases. As of this taping, we were getting ready to cross the mark of 500 cases in 11 different counties in our state. And we're also seeing it spread, unfortunately, to other states outside of Texas, from Oklahoma to Ohio. I'm wondering, how long do you think this outbreak is going to last, Dr. Cohan? Do you have any idea what might be a reasonable time period for people to expect?
So I think that the overall answer ends with us. The virus will continue to spread as long as it finds individuals, adults, children, babies, to continue to infect. So if the virus is in an area like it has found in the west area of Texas, it's possible that it could last more than a year. If it continues to find people who are vaccinated and it can no longer further spread and be considered a contagious infection, we'll be able to eliminate the virus and go back to the land before 2025. So
Yeah.
the answer is about how we want to take care of our own families and our own communities.
Can you give an idea of how our vaccination rates in the greater Houston area are? Like, do we have more of that herd immunity, a little bit more of that protection here in Houston?
Well, I can speak a little bit into the environment that I work in school settings. Right now, this time of the year, we're getting ready for pre-K registration. I know right now a lot of our local school districts are having roundups and registration events. So typically, we are closely monitoring as they're registering for those events. We're getting a lot of patients that are coming in for appointments to make sure that they're ready. Things that grade us as an organization are things like our immunization rates, which we're very proud of at Legacy. We continue to strive to continue to provide quality care for our patients. And so we want to mirror that with what is recommended by the CDC and as well as our AKIP organization. So we have different goals for our vaccines. Obviously, 100% would be the ultimate goal for our entire community. But anything really higher than 90% for a lot of these vaccines are going to give us a better level of protection.
Yeah, I mean, I think I've heard like the 95% is the goal for that herd immunity. I mean, I've seen stories, reports that there are some isolated schools in the greater Houston area where there's a very low vaccination rate. But do we know if generally across Houston we are close to that 95% rate, or is it just hard to tell?
So we know that certain areas in Houston definitely are at that 95% or above mark. We know that people live in communities that share beliefs, that share understandings, that share priorities. And so we use school districts as a way of measuring that data because we're able to collect that data. And so really we see that as far as school districts. And the Houston Health Department is closely monitoring those school districts with levels lower than 95% because that is exactly where children are going to be at risk from getting infected with the measles virus.
Speaking about data, I did see that those vaccination rates that we can track by schools and school districts because, Texas does require children who attend school to get vaccines, but families can request exemptions. And the number of those exemptions has doubled since 2018. So there are more families who are vaccine hesitant or delaying vaccines or choosing for whatever reason not to get them. Ms. Motu, you work very closely with families and kids. Why do you think we're seeing more of this vaccine hesitancy?
Well, I think it's a combination of just misinformation and and unfortunately, maybe a lack of trust just with where people are looking and obtaining this information. And I think ultimately, as healthcare advocates, especially for pediatric patients and families, our job is to ultimately build that trust with parents. It may not happen that first visit, but it may take over a few times, just kind of making sure that we provide that safe space and we're answering questions. I mean, I myself have children as well. And so typically when I'm talking to a family or a parent that's on the fence about any of the vaccines that we're going to be offering in clinic, I try to give the most accurate information and make sure that they have everything in their hands. And that will help them make that decision when they're ready to.
Tell me more about how you go about developing that trust. And I'm also curious to hear from you, Dr. Cohan, since you also work with children and families as a pediatrician. I mean, if there is a family who's had some misinformation or, hesitant, like how do you approach those difficult conversations?
The world is a scary place as parents. I share with Ms. Motu the experience of being a parent of two challenging teenagers right now. And I
Okay.
think we are always wanting our children to be safe. We want them to wear bike helmets. And that's not very cool. We want them to wear seatbelts, but then you can't fit the sixth person into the row. And I think vaccines are even harder to understand because we don't see what the risk is. It's
Mm.
really an imaginary risk. And so what I do is just understand where that parent is as far as what their level of fear is and what their values are and where we can find common ground. So if they can understand that I am truly recommending what I know based on years of data and something they may not want to hear, they just want to hear that their child will be safer one way versus the other.
One of the ways I do to help my parents feel comfortable in that setting is really just setting goals with the family. So providing that level of comfort. And then if they're not ready to talk about all of the decisions they're ready to make at that time, we'll again meet them halfway in the middle. And sometimes we have to set goals and okay, let's follow up and schedule them for that next appointment. And hopefully by that next appointment, we've gained a little bit more trust.
So keep the conversation going. It sounds
Definitely.
like keep the connection there. I'm curious to hear, what have y'all been seeing in your clinics since this outbreak has happened? Are you checking for measles? What are you seeing on the ground?
So, we are definitely seeing patients confirming that their children are up to date for their measles vaccinations and also asking if there's an opportunity to be vaccinated early. But it is really, for the most part, our populations are just very excited to do a little bit to protect their kids from something that we can when we can't protect them from the car accidents and the uh, school violence, unfortunately, and so many other things. This is an easy win for our patients.
I 100% agree with that. I think when we put that into perspective for parents, sometimes a lot of the times we have even more difficult conversations that come up other than vaccines. And I think when we put that as an option as far as something that they can help to provide that lifelong protection, I think it gives parents a better sense of having a little bit more control in how their child's ultimate health will be for the long run.
I would just add that I often have the conversation that the highest risk that a parent will take is driving their child to my appointment. That is the riskiest thing I will ever recommend to a family, is to actually come to the doctor's appointment. Anything else,
Because
because of the risk of accidents on the freeway, on the street, just being in a car. We know that seatbelts are only 40% effective at preventing major harm or injury. And so the actual transportation to a medical clinic is the highest risk thing that we will ever recommend to our patients.
you mentioned parents checking if their kids are up to date, and I have to admit that was me a few weeks ago. I just wanted to double check that my kids were up to date on their measles, and if not, like, needed to get them in. And just hearing you describe that interest from your patients, it makes me wonder, is this perhaps a silver lining in this outbreak, that we are getting a little bit more awareness about the measles vaccine, and maybe there's this new enthusiasm emerging for families to protect their kids with something that is backed by science and medical research. Does that resonate with y'all?
It definitely does, and it makes me hopeful because I think just asking the question gives us a sense that parents and families are feeling comfortable even having that conversation with their provider. And so I think that making them have that safe space that they can ask anything. I know often when I'm having appointments with teenagers, for example, one of the things that I usually tell the parent and the teen is this is a safe space. And I usually tell them there's nothing that you're going to ask me that's going to scare me. I think I want to make sure that they have all the confidence to be able to ask anything, even if it's something that we may not agree on. I want to make sure that I'm providing the best advice and pointing them in that right direction.
One of the values of being pediatrician is that your child doing well makes our day. So when we have parents that are reaching out, confirming their child's vaccine status, that is not a bother at all. That is exciting. That's saying that I can do something to help. And there really isn't anything easier than making sure that kids are healthy.
The Texas coast is special to me, and it's always calling me. My family has made countless memories there, and just off the Texas coast sits a unique beach town marked with salty vibes and sun-soaked memories, Port Aransas. It's a place where family traditions naturally unfold, and you'll find beauty in the island views while taking time to relax between adventures. And with 18 miles of shoreline, there are plenty of adventures, from kayaking with the kids to fishing off the coast or simply cruising down the beach in a golf cart, soaking in the sounds of the Texas coast. That sounds wonderful. Start planning your getaway now with your friends and family, because there's nothing like having multiple generations under one roof so everyone can enjoy those perfect beachfront mornings and that cool Gulf breeze in the evening. So many Texans have anchored their traditions to the island life in Port Aransas, and with one visit, you'll see why. Start your new favorite family tradition in Port Aransas, Texas. Plan your visit to Houston's beach at visitportaransas.com.
Lowe's knows member-only doorbuster deals make SpringFest savings even better. Right now, rewards members can get 3 19.3-ounce Bonnie Plants vegetables and herbs for just $10. Plus, save $50 on a Char-Broil Performance Series 4-burner grill, now $149. Lowe's, we help, you save. Valid through 4/7, excludes Alaska and Hawaii. Selection varies by location, subject to change while supplies last. Program subject to terms and conditions. Details at lowes.com/terms.
I want to go back to the outbreak. I mean, right now it really is more concentrated in West Texas. We've had a few measles cases recently confirmed in Harris County and Fort Bend County. But just to be clear, the public health officials have said those are tied to international travel. They're not connected to the Texas outbreak. But it's still kind of nerve-wracking to know it's over there and it could come here. What do you think the chances are of that happening, that taking root, Dr. Cohan?
So, when you mentioned that measles was previously declared as being eliminated from the United States, that didn't mean we didn't have measles cases on our land. So we still had measles cases that were brought in from international travel, but because there was no spread in the US, that's what deemed us as being measles free, or measles was eliminated. And so I do think we can get there. I also think that with the 3 cases that Harris County has seen, and now this one case in Fort Bend County, I think that's showing us how we identified where the cases were from. And since we haven't identified any further spread, that shows us that our communities are prepared and can be prepared for preventing that from spreading further. I wouldn't be surprised if at one point we do find that somebody from West Texas travels to Houston and it does spread. At the same time, this example is showing us how we can prevent that and minimize that. I will add in that COVID-19 has really shown our country what happens when we aren't protected from a virus, and a virus can spread very quickly. Measles shows us what happens when we are protected from a virus and the virus doesn't spread as quickly. The benefit of the technology and funding that we had accessible after COVID-19 had to do with monitoring the wastewater and identifying the levels of COVID, flu, measles. And so with the cases from January that were identified in Harris County, they were actually identified from the wastewater itself. And then they were able to track those cases north of the wastewater drainage to identify the cases before it became a community concern.
It is, comforting that it seems like our local public health officials are really taking this seriously and monitoring it, and also being very transparent about when some isolated cases have popped up because of international travel. But I was just looking earlier of the map of the US with, the different states where clusters of measles cases are popping up. And it really does seem to be moving into other states. And I'm wondering, is there a chance that this could become an even bigger problem, like a epidemic?
That's always a flexibility depending on kind of the situation and if all the factors are just right. So if we were talking about herd immunity, so if we're traveling somewhere that maybe there's a large portion of suspected cases, and even if someone's traveling outside the country as we're winding down for the school year and some people may be traveling, I think just knowing again what your immunization status is, and if you're not sure, making sure you're reaching out to either your child's pediatrician or your own provider. I know that in the clinics, we've been getting phone calls from not only families asking about their own child's immunization status, but we've had parents and as well ask what they need to do to better protect themselves. And some of the recommendations that we're giving our adult parents when they come in with their child is, to get them connected with either primary care if they've not been seen. So at Legacy, we're prepared to make sure that they also have those connections to make an appointment with our adult services team.
I was actually curious. I mean, unvaccinated children are at the most risk for the measles infection, but what about adults? Are there steps that adults should be taking to protect themselves, Dr. Cohan?
So adults fall into three different categories depending on their age and risk status. So if adults were born before 1957, they very likely had natural disease and they are presumed to be immune from measles. And so while the adults born before 1957 are also the adults that we're caring for as they age, I won't name any of my family members who potentially fall in that area. But adults before 1957, we don't recommend getting a vaccine or checking titers. If you were born between 1963 to 1967, you very likely got a less effective vaccine than we currently have. And it is recommended that you get a second dose of the current MMR vaccine. Earlier than that, I know a lot of adults do want to confirm their immunity status, and that's where they can discuss with their personal clinician. So we are not generally recommending that adults get their immunity checked by doing a blood test of their antibody levels or get a third vaccine.
Okay. So getting an extra booster is something that should be, it sounds like it should be determined sort of like on a case by case basis of these different risk factors or with their doctor, their clinician.
That's exactly right. So I want to make sure that we do have enough MMR vaccines, which productivity has not decreased at all. So we want the vaccines to go to the right people. At the same time, if you have received two vaccinations, you are 97% likely to be protected from the measles virus, and getting a third one does not increase your chance, nor does it benefit you from having a better level of protection than if you hadn't gotten that third dose.
Okay. Thank you for clarifying that. We've been talking about the measles, but I want to touch on very briefly other vaccines, the COVID vaccine, we have flu season. There's also RSV, which is an upper respiratory virus that can be really, really devastating for young children. What are y'all seeing in your clinics and schools with those vaccines in terms of availability and people willing to get them?
So typically for schools, we're seeing that a lot of our parents are coming in for recommended vaccines during the certain age periods that they are registering for school. So typically that's going to be our 4-year-olds that are needing the MMR vaccine that we're just discussing, as well as some other childhood vaccine boosters. And then we will typically encourage them to make an appointment every year to make sure their child is healthy. But sometimes we do see them make their way back to our clinics, unfortunately, maybe from a lack of access to healthcare at those other recommended time periods. So our 11 to 12-year-old age group is sometimes where that gap of time when we end up seeing students again, which is when they need their meningitis vaccines and their tetanus boosters. So one of the things that we discuss with our families, other than making sure that they're trying to get in for those appointments, is ensuring that their child is also overall healthy. Otherwise, see that our parents are open to getting that education. And it also opens the segue into discussing other vaccines that may not be required for school, such as the flu vaccine and the HPV vaccine and our COVID boosters. And sometimes they may make their way back once they're ready to make that decision, if there's some hesitancy, to get those as well.
It sounds like it goes back to what you were saying earlier of like having that conversation and keeping that connection and developing a relationship with these families. I guess as we wrap up, I wanted to ask, what's the best way for Houstonians to protect themselves in our local community against this measles outbreak? What would you tell people?
I think it is important for Houston and everybody to know that vaccines were developed in order to save lives. Vaccines were never developed to prevent the itchy rash of chickenpox or prevent the sniffles from the flu. Vaccines like measles were developed to prevent the permanent hearing loss, the brain damage, the increased susceptibility to other reactions. Vaccines were developed to save lives. And I think this has really given us a good opportunity to say, I know we don't see those things anymore because we haven't been seeing those measles cases.
And, speaking of saving lives, it's just so tragic that we learned over the weekend that a second child in West Texas died from the outbreak. This was an 8-year-old girl. She was not vaccinated and she got the measles and then developed complications. And her funeral was Sunday. And it's just so tragic. And we hope that there are no more fatalities and that we can contain this outbreak.
That's exactly right. So I hope that each child and their parents and their aunts and uncles and family are each able to enjoy their lives in a healthy way. And I think vaccines can help us do that.
Thank you. Ms. Motu, anything else that you would like to add that I haven't asked?
I think that making sure that parents know that no matter what it is that is worrying them in the news and what concerns they may have, that they feel like they have a safe space when they come and see us at our clinics.
Thank you again for coming on. Both of you really learned a lot in this conversation.
Thank you, Laura.
Thank you.
That was Lorena Motu, a nurse practitioner and the director for school-based health at Legacy Community Health, and Dr. Sandy Cohan, the medical director at Legacy's clinic in Southwest Houston. I feel like I learned a lot about measles in Texas, and I actually feel better about the cases now. So help out the worried parents in your life and send them this episode. Please subscribe if you haven't already and give us a rating and review to the podcast wherever you're listening. It's really one of the best ways for us to grow the show. Stay up to date on the latest in Houston with our daily newsletter, Hey Houston. That will do it for today. I'm Laura Eisensee. Thank you for listening, and I hope you learned something new. In thinking about the spread and those vaccination rates, we know that in these counties where it's just really gone viral, no pun intended. I should retract that.
I thought it was actually well done.
Okay.
That was intentional.
Yeah, no pun intended.